Hello everyone. In our today's lecture, we are going to continue with our pharmacokinetics as we discussed the principle in last lecture ADME. A for absorption we discussed in last lecture, and in this we will start with D, distribution. Distribution is the movement of drug to the various parts of the body from blood vessel, bloodstream. It mainly depends on the four factors, which are: first is lipophilicity, second is blood flow, third is capillary permeability, and fourth one is plasma protein binding. Starting with lipophilicity, if a drug is lipophilic, then it can easily move to the tissues, and if the drug is hydrophilic, then it will try to inhibit such areas. Now about blood flow. As we know, blood flow to the organs like brain is higher as compared to skin. The drug will distribute to the brain easily as compared to skin. Now capillary permeability, liver has higher capillaries than brain, so the drug to liver will be distributed easily. At last, plasma protein binding. Albumin is a kind of plasma protein. If the drug binds to it, then it loses its individuality and try to inhibit the distribution. Now plasma protein binding, shortly we can write it PPB. Now what factors are affected by high plasma protein binding? Firstly, distribution. As we discussed earlier, the drug loses its individuality if it binds to a drug, so distribution will be decreased. Duration, drug become larger after plasma protein binding, so it will take more time for its distribution, so duration will be increased. Displacement interaction, like we can take example of two drugs like sulfonamides and warfarin. They can displace each other places at they bind at same place to a receptor, so the plasma protein binding will affected. At last, dialysis. There are drugs for dialysis. We have mnemonic, the effective dialysis drug, and not effective dialysis drugs. The effective includes MLA as a mnemonic, like member of legislative assembly. M stands for methanol, L for lithium, A for aspirin. Non-effective drugs are avoid dialysis. A for amphetamines, verapamils, opioids, mipramine, digoxin, and diazepam. Now about the formulas, starting with volume of distribution. Volume of distribution equals to the amount upon PC, in which amount stands for the amount of drug in the body and PC stands for the concentration of drug in blood plasma. Next is the concept of pharmacokinetics. The remaining principles M and E, which are concluded under elimination. M for metabolism, which is breakdown of drug, and E for excretion, removal out of the drug from body. Starting with metabolism. As metabolism is breakdown of drug by various enzyme inducers, enzyme inhibitors, etc. Like starting with active. Active drug after metabolism become inactive. Example, almost every drug follow the same pattern. Before metabolism they are active, after metabolism they become inactive. Some drugs remain active after and before the metabolism. Example for this is diazepam. Diazepam is active drug. After metabolism it becomes oxazepam, which is also a active drug. Now concept is inactive to active. Drugs before metabolism are inactive, after metabolism become active. These drugs are known as prodrugs. We have mnemonic for prodrugs, and it is a kind of medical term we use. All prefer doing MD, which is master degree in clinical subjects. All stands for ACE inhibitors. ACE inhibitors are the pre-landing drugs, except captopril and lisinopril. These are not prodrugs. P stands for proton pump inhibitor, prazole-ending drugs. D for dipivirafin. M for 3 drugs like methyl dopaminoxidil, 6-mercaptopurine. D for levodopa. I, N for irinotecan, anti-cancer drug it is. C for carbimazole, clopidogrel, and S for sulfasalazine. Irinotecan, it is a kind of anti-cancer drug. Now enzyme inducer drugs. The enzyme inducer drugs increase the rate of metabolism for a drugs. For this we have a mnemonic which is GPRS cell form, which are used in earlier times, like G stands for bisofulvin, P for phenytoin, R for rifampicin, S for smoking, C for cell for carbimazole, and phone for phenobarbital. Now enzyme inhibitor drugs, the metabolism is inhibited or slowed down by these drugs. For this we have mnemonic vitamin K can cause enzyme inhibition, which stands for valproate, K stands for ketoconazole, C for cimetidine, again cause for ciprofloxacin, E for erythromycin, and I for isoniazid. Isoniazid is a kind of anti-tuberculosis drug, first line drug. Now the last concept of the pharmacokinetics, which is excretion, removal out of drug from body. In this we talk about toxicity. Like if toxicity of acidic drug like aspirin occurs, now what we can do? We will try to make the medium basic by the compounds like NaHCO3. NaHCO3 will make the medium basic. Now we have basic toxicity like drug amphetamine, basic drug toxicity. In this case, we will try to make the medium acidic for the easy removal of the amphetamine. For this, we can give the compound like NH4Cl, which is a kind of acidic compound which will easy removal of amphetamines. Now about the rate of elimination. For this, we have a formula which is elimination rate equals to the clearance multiplied by the plasma concentration of the drug, which is denoted by C. Now clearance it is the removal out of the drug from a specific organ in which the process is unknown. For this we have formula is clearance equals to the elimination rate upon the plasma concentration of the drug. Now what is first pass metabolism? First pass metabolism is like we gave any drug orally and it is metabolized before reaching to its targeted organ. It is metabolized like 50% metabolized. Now the drugs which have high first pass metabolism, we have mnemonic for them is LPG. L stands for lignocaine, P for propanol, and G for glyceryl trinitrate, which is a anti-anginal drug, can be used as self-administrative drug for angina. Extraction ratio, it is a kind of phenomena. It depends upon the concentration which entered the liver for and minus concentration leaving the liver divided by concentration entering the liver. Hepatic clearance, it includes like it have a formula like hepatic extraction ratio multiplied by the hepatic blood flow. Last concept of the pharmacokinetics is order of kinetics. There are mainly two orders. Zero order kinetics. We will learn mainly three concepts in this: rate, half-life, and clearance. Rate in zero order kinetics is constant, remains constant. Half-life is directly proportional to plasma concentration, and clearance is 1 upon plasma concentration. In first order kinetics, rate remains directly proportional to plasma concentration, half-life of is constant of first order, and clearance of first order is also constant. We will give example for these for easy learning in this. Now we have a formula of half-life which is 0.693, which is log of 2 multiplied by volume of distribution and divided by clearance. By this we can calculate the half-lives of drugs. Zero order drugs, we have mnemonic for these drugs, as the drugs included in these mnemonic are of zero order and the other remaining drugs are of first order, in which 0 watt power, 0 for zero order, W for warfarin, A for alcohol or aspirin, T for theophylline, again T for tolbutamide, and P for power phenytoin. Other drugs are first order drugs, or some are second order. Now we have an example in this for easy learning. You can see the first order, as the plasma concentration is in starting is 100 and after 1 hour it become 50. So for calculating rate in this, we can take R is equals to 50, which is the amount, upon 100, which is the earlier plasma concentration. Our clearance comes half. In every case our clearance is half, so it will prove that the clearance in first order is constant and the rate in first order is directly proportional to plasma concentration. Similarly, you can see in the zero order. In zero order, the plasma concentration after 1 hour is decreased to 80. So difference is of 20. The 20 is the amount and the 100 is our plasma concentration. So rate is 20 by 100. Clearance comes 0.20. As clearance is not constant in this, clearance of zero order is equals to 1 upon plasma concentration and the rate is in constant. Now that's the end of pharmacokinetics. Thanks for watching lecture. Subscribe to ReadyMed. Stay safe.